Hello everyone, Dr. Sam Schroetke here at Physical Therapy and Hand Clinic of Hillsboro, bringing you Technique Tuesday, and we are continuing our theme of hip pain or sacroiliac joint pain, also the SIJ, you might see that written. I've talked about this in previous videos, but if it's hip pain, you're likely to have, ignore the string there, you're likely to have pain in the front. If it's sacroiliac joint pain, you would be having pain, there's kind of that knobby bone there. It'd be there, a little below that, and down. That tends to be where the sacroiliac joint manifests itself. If you are having pain in the buttock region or on the outside of the hip, I would encourage you to rule out the lumbar spine first. So work with your physical therapist and see if it is coming from your low back, or try one of the low back videos, low back pain videos we did, especially the one with extension, to see if that helps. All right, so I already did one video for sacroiliac joint or hip pain that responds to flexion. I was lying on the table. I'm going to show another alternative in an upright position. So for some reason, sometimes you just have to change the body position because it's a force alternative, and that has a better effect for you. If you're trying the one laying down and it was working, don't do this one. This is only if that one was not working, okay? So the nice thing about this one too is it's easier to do at work, unless you have a job that allows you to lay on the floor sometimes. So for this one, you're going to need a wall or a door. You're going to come up. We're going to say that I have, let's say I have right-sided hip pain, and I would walk, have your feet staggered maybe 12 inches or so from the door. So I have right-sided hip pain or sacroiliac joint pain. I'm doing flexion, and I'm just going to bring my knee up and then a little overpressure and back down. Knee up, a little overpressure. Every time I'm going all the way back down, I come up, pressure on, pressure off. With every repetition, I'm trying to pull my knee closer to my chest. It's having more flexion force in my hip, and it's rotating my pelvis backward a bit if you're having sacroiliac joint pain. Okay, 10 to 15 repetitions. Working on getting to end range, that's where the magic happens. That's our mantra for a lot of these exercises. 10 to 15 reps every 3 to 4 hours, or 5 to 6 times a day. Check whatever it was that was difficult, walking, squatting, whatever it was, sitting. Try a set of those and see if it's better. If it's better, it's likely the right exercise. Sometimes you got to give a little more time than that. A lot of these exercises, when you do them, the first couple of reps might feel uncomfortable or even a little painful, or it might feel restricted. They should get better as you go, or when you're done, it should feel better. Okay, so repeated hip flexion in standing. That's what we're doing here. Repeated hip flexion in standing. Working on getting to end range, 10 to 15 reps every 3 to 4 hours, or 5 to 6 times a day. Like us on Facebook, like the video, leave comments, ask questions, ask about techniques. We'll get back to you. I'm Dr. Sam Schroetke here at Physical Therapy and Hand Clinic, bringing you Technique Tuesday. Always check with your physical therapist or physician before doing any of these exercises to make sure they are appropriate for you. Thank you.